My name is Douglas Summerfield. I'm a fellow in critical care medicine here at Mayo Clinic. This is my first year at Mayo. I previously trained at Eastern Virginia Medical School for my residency in internal medicine, and I went to medical school at Creighton University in Omaha, Nebraska. I'm somewhat local in that I went to college at Luther College in Decorah, Iowa, and I grew up in a small town that nobody's ever heard of called Dresbach, Minnesota, which is right on the Mississippi, right north of La Crescent, Minnesota. I probably knew I wanted to be a doctor since I was in about third grade. It's been one of those goals that ever since I've been knee-high that I wanted to shoot for. And kind of slowly as the years progressed, I just kept fine-tuning that. Initially, I probably wanted to be a doctor for the wrong reasons. Even at that young age, I realized my eyes were too bad to be a pilot. So I thought, well, I could be a flight surgeon in the Air Force, and then my eyes can be bad. So that was, when I was in third grade, I kind of had realized some of this stuff. And as I got older, it became more about taking care of patients and the challenges that's associated with that. I also did join the Air Force part-time, and I am a flight surgeon, but taking care of healthy people is also, in the Air Force has its own rewards, but taking care of critically ill, challenging people is something that's really sparked my interest. My interest with the Air Force is more, and altitude is actually interest in medicine in extreme environments. With the Air Force, I've been able to participate in space shuttle landings. I've been able to go north of the Arctic Circle to care for patients and go into remote places such as remote areas of Spain to care for patients. And so it's kind of come full circle between extreme environments and then taking those extreme environments and caring for people in extreme environments and bringing it back to the ICU and being able to treat patients. My role will be as a researcher on the team, but I believe I can bring a unique perspective to having hands-on clinical experience. Dr. Johnson's lab has had a lot of experience going to high altitude, and whether it's South America or Pakistan or even remote areas such as Antarctica. And I think their lab is focusing on looking at people in extreme environments and taking the changes that we see in patients in high altitudes and extreme environments and relating that to critical illness. And hopefully I'll be able to add to that ability to do that just because I see patients in critical settings. One thing that really sticks out to me is just the skills in using the ultrasound. If I can use an ultrasound at the base camp of Everest, I should be able to use it in an ICU. And validating some of the techniques that we're using in the extreme environments, such as lung comet tails as a marker of extravascular water in the lungs, and being able to use that technique later on to detect patients with heart failure that need treatment. And maybe 30, 40 years in the future, being able to detect patients before they need even hospitalizations with the remote monitoring and with the ultrasound, and treating them before they need to come into the hospital. So I think in 20 years we'll probably see more monitoring of patients outside the hospital. One of the projects of this study is looking at heart rate variability and how changes in heart rate variability can help predict arrhythmias. So if we have patients that are at high risk of having an arrhythmia and dying outside the hospital, being able to catch that and get to them in a quick manner and make an intervention before it's too late. That's probably one key thing that I see in 20 years. I'm excited and nervous at the same time. Nervous because I don't know how my body will react at that altitude. Nervous because we're kind of putting our lives on hold here at Mayo Clinic as far as clinical interactions, and our families will be back home as well, and I'm sure we'll miss them, but also very excited to go and be a part of this. Growing up in a small town in Minnesota, my hometown had 110 people, 109 in it after I left. The whole ability to even come to Mayo Clinic was amazing, and to be in the critical care department here, let alone go into Everest. I mean, this wasn't even in my wildest dreams. And so, the ability to go there, gather data and research, and bring it, be able to make use out of it to treat patients is just beyond anything I could have ever expected. So.